Welcome back to the channel. I'm Ode, and today we're getting real about caring for our elderly loved ones. This is something every family faces, and even with the best intentions, we can make mistakes that hurt both our loved ones and ourselves. We're not here to blame, but to get smart and proactive. Today, we'll break down the 7 most damaging mistakes families make in elder care. Mistakes that can lead to resentment, depression, and unnecessary pain. I've seen families torn apart and caregivers burn out because they didn't have a plan. It's time to change that. Avoiding these pitfalls is essential for your loved one's dignity and your own well-being. Ready? Let's dive in. Mistake number 1. Thinking we know what's best and ignoring our elders' wishes. Too often, families make decisions about their parents' lives without including them. Imagine if someone took away your car keys or sold your house without asking. How would you feel? Aging doesn't erase a person's right to make choices. When we ignore their input, we strip away their autonomy and dignity. This leads to resentment, depression, and a sense of hopelessness. Seniors may withdraw or resist care, not out of stubbornness, but as a plea to be heard. The fix? Start listening. Have honest conversations. What do you want? What are you afraid of? What would make you feel safe? Present options, not ultimatums. Treat your loved one as the head of their own care team. Their preferences might not match your convenience, but compromise is key. If they want to stay at home, work together to make it safe. Remember, this is their life, their final chapter. By honoring their wishes, you give them dignity and show they still matter. Don't silence the most important voice in the room. Mistake 2. Waiting for a crisis before making a plan. Many families hope for the best and avoid tough conversations until an emergency forces rushed decisions. Crisis-driven choices are made under stress and rarely turn out well. You might end up with the wrong care facility or financial commitments you can't sustain. Planning ahead is an act of love and responsibility. Have the what-if talks while your parents are healthy. What if you can't live alone? What care do you want? Who should make decisions if you can't? Get legal and financial documents in order. Power of attorney, living will, advance directives. Know where these documents are. Discuss finances openly. What resources are available for care? What's affordable? Don't wait for a 2 a.m. emergency call. Start the conversation now, even if it's uncomfortable. Frame it as honoring their wishes and protecting the family. Planning won't make the journey easy, but it gives you a map instead of stumbling in the dark. Be proactive, not reactive. The best care starts with a plan. Don't let your family fall off a cliff. Build your bridge now. Mistake 3. Focusing only on physical needs and neglecting emotional well-being. You might provide meals and medication, but are you feeding their soul? Loneliness is as dangerous as any illness, linked to depression, dementia, and even heart disease. Seniors' worlds often shrink as friends pass away and mobility declines. Isolation can make their home feel like a prison. Fight loneliness intentionally. Don't just drop off groceries, spend real quality time. Listen to their stories, look at old photos, and remind them they matter. Help them connect with others, senior centres, hobby clubs, church groups, or even video calls with family. Watch for warning signs, withdrawal, loss of interest, or talk of being a burden. Acknowledge their feelings and work together to find solutions. Emotional care is as vital as managing medications. A full belly means little if their heart is empty. Be their lifeline to the world. Don't let your loved one fade into loneliness. Connection is the best medicine. Mistake 4. Overlooking safety hazards at home. The familiar home can become a minefield for seniors, especially when it comes to falls. A simple fall can change everything, leading to injury and loss of independence. Walk through their home with fresh eyes. Remove throw rugs, secure cords, and clear clutter from walkways. Improve lighting. Add night lights and brighter bulbs, especially in hallways and bathrooms. In the bathroom, Install non-slip mats, grab bars, and consider a shower chair. Reorganize the kitchen so essentials are within easy reach. Check smoke and carbon monoxide detectors. These small changes prevent big disasters. Safety modifications aren't about making the home sterile. They're about preserving independence. Don't wait for an accident to act. Do a safety audit now. Protect your loved one's dignity and well-being. A safe home is a loving home. Prevention is everything. Mistake 5. Thinking you can handle everything alone. Elder care is complex. Medical, legal, financial, and emotional challenges abound. You're not expected to be an expert in all of it. There are professionals, geriatric care managers, doctors, elder law attorneys, financial advisors, whose job is to help. They can assess needs, create care plans, and connect you with resources. Don't see asking for help as failure. It's wisdom. The cost of professional advice is far less than the cost of mistakes. Get a team in place, medical, legal, and financial. Be your parent's advocate at appointments. Don't try to do surgery on yourself. Get the right help. True strength is knowing your limits and calling in experts. Build your support network. You and your loved one deserve it. Mistake 6. Trying to be a superhero and burning yourself out. Caregiver burnout is real, physical, emotional, and mental exhaustion that helps no one. You can't do it all, and you shouldn't try. Delegate tasks to siblings or friends. Be specific about what you need. When people offer help, say yes. Keep a list of tasks others can do. Schedule regular respite. Hire help. Use adult daycare, or ask family to step in. Taking breaks isn't selfish, it's necessary. You can't pour from an empty cup. If you burn out, everyone suffers, including your loved one. Respect your limits, build a team and share the load. Caregiving is a marathon, not a sprint. Take care of yourself so you can care for others. Drop the superhero cape. You're human, and that's enough. Ask for help, accept it, and make self-care a priority. It's the only way to survive and thrive. Mistake 7. Mismanaging medications. A life and death issue. Seniors often juggle many prescriptions, leading to confusion and dangerous errors. Don't assume they have it under control. Do a brown bag review. Gather all medications and review them with a doctor or pharmacist. Create a clear medication chart, what, when, and why for each pill. Use pill organizers or automated dispensers for complex regimens. Keep the chart updated and share it with everyone involved in care. Communicate with all healthcare providers. Make sure everyone knows the full medication list. Double-check every change and ask questions. Be vigilant and organized. Medication mistakes can be fatal. Your diligence saves lives. Take command of the medication process. When it comes to pills, there's no room for error. There you have it. The 7 deadly sins of elder care and how to avoid them. This isn't about fear. It's about empowerment and compassion. Be proactive, be a partner, and build a team. By avoiding these mistakes, you'll protect your loved one's dignity and your own well-being. Share your experiences and tips in the comments. Your story could help someone else. If this helped you, like, subscribe, and turn on notifications. We'll keep having real conversations to help you care for those you love. Until next time, take care of yourselves and each other.